My name is Dr. Rian Adam. I'm specializing in internal medicine in Omdurman Teaching Hospital. A common illness that's common in Sudan is cholecystitis, and I'll explain cholecystitis. Cholecystitis is inflammation of the gallbladder. The gallbladder is a very vital organ and it's responsible for storage and secretion of bile. So imagine it as if this gallbladder has become inflamed or infected. So what happens is that the bile cannot be secreted. So every time a person ingests food that has cholesterol or fats or anything, the body rejects it. So what happens is that the bile cannot be secreted. So the person cannot break down these fats. This results, if it gets untreated, it can result in you to remove your gallbladder, which is cholecystectomy. And medication in Sudan has become very expensive. So in order to treat a patient with cholecystitis, the first thing you have to do is administer them to the hospital, and then you have to give them IV fluids, restore their fluids, electrolytes, and prevent nil by mouth, like nothing should enter their body. This is the initial therapy. The medical therapy is you give them antibiotics, and they're ranging from different types of antibiotics due to what organisms and the level of infection, the level of severity, and how the patient is actually, the condition of the patient. On average, for a working class person, it's very expensive, especially the cholecystectomy act, the removal of the gallbladder. Another common case of an illness in Sudan is diabetes. And diabetes, there's no treatment other than medicinal. There is oral, and then there's insulin. Just to highlight how prices increased and inflated in Sudan, is that this used to be £7 and now it's £26. So if a patient comes to me and they cannot afford the prescribed drug for them, and so they go to the pharmacy, and the pharmacy either refers them to Sharia Hawadis or they directly go to themselves. And Sharia Hawadis is a charity organization that helps patients that cannot afford medications. So they all gather together to collect funds in order to help those who cannot afford medications. They're located outside hospitals.